Couple of other Weezie's angels that we're going to be meeting right now are Nurse Patty Toney and Dr. Shad Deering. Good to see you both.
Good to see you.
Yeah.
And congratulations to both of you.
Thank you. Thank you.
This is the second time around for you, isn't it, Patty?
Yes. So I'm quite honored, frankly, and surprised.
Well, Shad, what do you think about it, being honored like this?
Oh, I was completely surprised. I got an email and then a phone call, and everything's just so odd in these days of COVID. It was I started to read about it, and it was named after, and I'm really humbled. It was really nice.
If you could say that again, please, because for some reason your microphone got really weird just then.
So it was really unexpected in these times of COVID where everything's virtual and you just get these emails. It was I started reading about it once I got it, and I was really humbled, and it was a really nice thing to see.
So Patty, you've been a nurse for 40 years?
Yeah, 43.
Okay, and Shad, you were in the military. Has anything in your previous careers prepared you for this?
Oh, that's a great question. So, I don't think any of us have been through a pandemic before. I've deployed and taken a team into overseas into a combat zone. So in some ways it's a little bit like that. But the great thing about it is when you see something like this happen, I mean, good teams do well, great teams really come together. And the team here at the Children's Hospital has just done a fantastic job of preparing the staff, being ready for our patients. It's definitely a crisis, but it's one that I think's really pulled everybody together.
Patty, what was your secret?
I think Dr. Deering just said it was teamwork and cooperation. Not only within each hospital, within all the hospitals within our ministry in San Antonio, which include New Braunfels and San Marcos, and then within the regions, and then at our system level, there was quite remarkable coordination from the system corporate level all the way down to the facilities.
So Patty, you were in charge of making sure those in direct contact with the patients, you had everything you need from A to Z, from Band-Aids to face masks and everything in between, right?
Mm-hmm. Yes, myself and certainly all of my CNOs and supply chain people. And, something like this takes a village. And it took quite a few people. But yes, I had oversight for Santa Rosa, in particular in regards to working with STRAC on staffing, because that was a huge need. As everyone knows, it's no secret, PPE in the very beginning was a bit of a challenge nationwide. But we quickly caught up and now have absolutely everything we need in terms of PPE. I think the other piece that was challenging for all of us across the nation in healthcare was as we learned more about this virus, guidelines from the CDC changed rather frequently and appropriately so. And so getting everyone to respond to that in a timely manner was challenging. But I think we did, frankly, a really good job of communicating amongst our hospitals and within our healthcare system to keep up with those changes and keep people informed.
Shad, what about I guess you call it the intangibles, the things that aren't on the list of items needed, the meetings or anything like that? What were the little things to help everybody get through this?
Well, I will tell you that one of the little things that I really enjoyed was actually Patty, because we would be on phone calls and we'd be talking about PPE and different things. And she just has this awesome, calm demeanor and calm voice that just makes you feel like things are going to be okay. And what we really tried to focus on here with regards to, we can talk about PPE, and I like what you said in terms of, there's a lot of stuff and a lot of protocols and processes and things like that. But really it was just about getting everybody on the same page, understanding that they had to be flexible. We would say things often like, okay, it's Monday at 8:00 in the morning and here's the ground truth for right now. Realize it may be different in an hour. And just being realistic and upfront about, hey, this is going to continue to change. And just seeing how flexible people were and just communicating. We made badges. We actually made some stickers. if you can see this, it says "Not today, COVID-19," and we passed out stickers. We had nurses who would decorate the hallways for when the associates would come in, just with encouraging things like that. And it was just something to really kind of pull the team together, because again, this is unprecedented, and you know, it's scary when you don't know what's going on.
And then you also set the goals, doctor.
We do, and the goal was really simple. The goal was everybody lives. That's where we started. Actually, when they called me and asked me to be the COVID incident commander, I went back to my office, I grabbed the board and I said, okay, what are the goals for getting through this? And, you know, actually wound up writing that down 3 times in a row. So that's kind of what we told people. Our goal for the staff is to be here for you. Our goal is to make sure that you're safe and that you have everything you need to do your job. And if we can do that, then we can be here for our patients.
Patty, being there for patients, talking with some of the other nurses, I know a lot of them have said nurses like to hold a hand, a pat on the back, but it was tough in this situation, and probably even tougher on the nurses not being able to do that. How did you all kind of, I don't know, cry on each other's shoulders?
Well, we did a lot of that, frankly, and did that, you know, in nursing break rooms, in safety huddles in the morning. Leaders gave their folks an opportunity to talk about how they're feeling about, you know, perhaps the previous shift, what went well, what can we do differently, what barriers in your way, how do we help remove those. We used our internet within our system a lot for support, motivational messages. We did all kinds of Zoom meetings, coffee chats where our associates could just dial in and talk to our leaders that are trained in listening carefully and supporting colleagues. Our chaplaincy was huge, huge support, and they made rounds regularly on all the units, including the COVID units. And so they were available night and day. And I have to, you know, kudos to our presidents and our CNOs who intentionally made sure they were rounding on the off shifts, on the night shifts, on the weekends, so that people knew we were available.
And Shad, in your bio, it says, I mean, humor can be the best medicine.
You know, it's one of those things when you're in a stressful situation, people need to know that, number one, you're trying to take care of them. But, you know, when you're having these meetings, Zoom is hard. It's difficult. Whenever, what I'm used to in every other situation before, it's if there's a crisis, you get everybody in the same room and you have the discussion and you go over stuff, and you just couldn't do it here. So having to do things by Zoom has been new for all of us. And so, you know, we try and put a little bit of levity in, try and keep people, you know, relaxed, because it's stressful. And so sometimes you need to laugh.
Patty, what would be the toughest thing? If it was you know, was there a single incident that kind of sums this up?
You know, I think the toughest thing, and if you asked any nurse or doctor this, I think you would hear this everywhere you ask the question, was that some of our patients had to pass away with only us at their bedside and their family on Zoom. There were patients that, like I said, that passed away, not alone, we were with them. Nurses, doctors, holding their hands. But there was a couple of difficult situations where families couldn't be there. And that was tough. That was tough on the staff.
How about you, Shad?
I mean, I'd echo what Patty said. I think, you know, in those situations where you do lose a patient, it affects the whole team. I would say outside of that, probably the most challenging thing has just been the uncertainty. And, you know, you have staff that are coming to work every day, that are on the front lines, that are going in, that are putting themselves, you know, purposely in those rooms to care for patients with this disease that we just are still learning about. And watching the stress on them in terms of, you know, thinking about like, okay, they're going to go home to their family and they're worried about themselves and they're worried about others. And so it's been hard to watch. I think the thing that Patty and I have really both focused on is making sure that everybody feels safe. And that's our providers need to feel safe, that they have every bit of equipment that they need so that they can go, they know that they can do their job and then they can go home and feel safe. And then our patients need to know that we have all of those protocols and procedures in place so they can come. If they feel sick, if they need to come to the hospital, they need to come and they need to not be afraid of that, because we literally have put every single protocol in place for that.
What's the advice for the future other than people knowing that they're safe to come to the hospital?
I think it's 3 words right now. It's wear a mask. So let's start.
Wear a mask.
Wear a mask. We're on our second, I would say this is the, we had the initial influx of cases. We had the lull. We had our second surge. We're coming up to Labor Day. After Labor Day, we're going to see how people do over the holiday. Schools are hopefully going to be able to go back in session. So, I mean, really and we've told this to our associates here too, you are really safer at the hospital because we have screening and everything in place. When you go out, that's where we're concerned about people getting the infection. And so we're encouraging people to wear a mask, to take these things seriously, because we don't want to keep going through the same pattern.
What is, if you can find a bright spot or a happy moment in a pandemic like this and people dying, what would be one of them, Patty?
Well, again, I know I keep going back to teamwork, but it was so essential here. And it takes a village. It really does. It takes laboratorians. We don't often get a lot of credit because they're down in the lab, right? But my goodness, do we rely on them? It takes housekeepers. It takes dietary, nurses, doctors, respiratory therapists. My goodness, can you imagine in this pandemic how much we relied on them? Our supply chain folks, the guys that run, work down in supply. I think we had to lean on each other harder than we ever did before. And I think everyone became more acutely aware of the fact that it does take a village. Everyone's got a role and everyone plays an equally important part.
How about you, Shad?
Yeah, I think that's very well said. I think for me, it's given me the opportunity to get to know my entire institution, from the housekeeper to, the president and CEO. I've gotten to know them way better. And I think Patty said it really well. There's a lot of things that we take for granted. Because we don't realize that we need them every day. Logistics is one of my favorites because, without logistics, without having the PPE and everything available, we'd never be able to do this. So I think it really has brought an awareness of the value and what all of those people bring. And I think that's a good thing going forward.
The other thing I would add, Dr. Deering, and you made me think about it, something you just said, was our resiliency and ability to innovate. Those first few weeks of the surge in San Antonio, that was the part I don't think any of us had ever seen, with that number of influx of very sick patients into our hospitals. And we were opening up units, moving people around, sometimes within hours of each other. You had presidents of the hospitals and physicians pushing beds around to set up another unit, to find the equipment, to properly equip the unit. That was remarkable to watch, and it kind of went by in a blur. That's what it felt like anyway. And people working around the clock 7 days a week to make sure that patients had a place to go and were safely cared for.
Well, again, congratulations to both of you and hats off.
Thank you. We appreciate it.
And you know what? Hats off to San Antonio, and my hats off to STRAC. We are blessed to have that as an organization in this city. And it was neat to watch all the hospitals come together and work together. So just wanted to put that out there. It's something that San Antonio should be very proud of.
That's great. Thank you both very much.
No, thank you. We appreciate it.
Opportunity. Take care. Bye, Dr. Deering.
Bye-bye.
Bye.